this a couple of seconds, make sure it's all on, and then I'm going to go through cholesterol, how to affect it through your lifestyle as opposed to medication, because that's the biggest thing that people can influence, and I'll go through the reasons why now. If I do excessively cough throughout the whole thing, I am on the back end of a cold. And also, hopefully you can see this whiteboard. It was meant to be larger, but obviously it wasn't the right size when I booked it. So, cholesterol. Why am I picking cholesterol? And the reason being is that cholesterol is one thing that's brought up a lot. And I think it's pretty apparent now that cholesterol has a causal link with heart disease, heart attacks. It is not the only thing that causes it before everyone jumps in and says, oh, I can have high cholesterol, and the studies saying high cholesterol people live until they're 100. Yes, there are many things that are contributing towards heart attacks. However, having a high amount of cholesterol is one of the big things that will also drive that process. So, in my opinion, we should be trying to lower it. But before we jump straight into using statins and other pharmacological treatments, there are a lot of ways that we can do it through lifestyle, including diet and exercise. But the level of education that healthcare professionals normally get and the level of advice that's given out to patients is normally, well, it's under par, basically. So what I thought I'd do is I'd go through a bit of physiology, because you've got to understand physiology to then see why the lifestyle changes that you're doing can impact your cholesterol going forward. So let's go on to, and I'm not going to cover a lot of myths or anything. I'm just going to go through this process, and if there are any questions, I will come to it at the end, because I'm filming on the back end of a phone, so I can't see any questions going throughout it. So when we measure your blood levels of cholesterol, it is only getting about 10% of your total body stores. The other 90% is usually within the brain. You've got it within a lot of cell membranes, normally red blood cells, and then we have it in many other tissues. And the reason is that the body, well, every cell in the body can actually produce its own level of cholesterol. And the things that are within the blood are just a mere fraction of what we need. So that's why it's sort of a simplistic overview of why we don't really need to have high levels of blood cholesterol, because every cell in the body, apart from red blood cells, can make its own supply. But where does that supply come from? So you've got diet, which contributes about 20% of your blood levels of cholesterol come from your diet. The other 80% come from the body making it itself. And the way I need to bring this up, because I'm going to go into how diet affects this 20% and how diet can affect the 80% with exercise. So that is the main thing for total cholesterol within the blood. Now, when you are looking at it from a dietary point of view, there was a thing, well, many years ago, where definitely the American Society for Dietitians were advising that you were to have no more than, give or take, 300 milligrams of cholesterol a day. Now, when you actually put that into perspective, that is literally less than 2 egg yolks each day. However, that has since been removed, and the reason will become more apparent the more I go into this. So, going into why this recommendation was removed and how you can influence your cholesterol levels through diet, first starts with how we absorb cholesterol in the body. So, when you are eating food, I'm going to do this as the head, and then the intestine, and then obviously the back passage. When you are eating food, anything that goes into the mouth, the stomach, the intestine, that is all classed as outside the body. And for us to account for that cholesterol, we've got to first absorb it. So I needed to make that apparent for this part, because this here is classed as the lumen. So this is your intestinal tract. So technically, it's outside the body because we have not absorbed it yet. So if we have cholesterol in the diet, which usually comes from, well, it normally comes from animal sources, but I'll come on to that in a minute. In order to get that across the intestinal wall, you have to go through this transporter. For completion, it's called Niemann-Pick C1-like one. And then the body also regulates it. So if there's too much cholesterol in the body, it will also kick it out through, for completion again, A, B, C, G5, G8. You don't really need to know that, but you can look into it a bit more. So if we can impact this transporter here and affect the amount of cholesterol absorbed, we can then obviously reduce the amount of cholesterol within the body. Seems a bit logical. But there are a few things that we need to take into account. So the average diet within the West has about 400 milligrams of cholesterol each day. And why I'm bringing that up is because each day the amount of cholesterol that comes into the intestinal tract is about 1 to 2 grams, which is, for those who don't know, 1,000 to 2,000 milligrams. Now, if the average diet contains 400 milligrams, where does the remainder of that come from? And it actually comes from the bile salts from the gallbladder and the liver. And the reason why we need bile salts is to absorb fats. So we're getting on average 1,200 milligrams, give or take, of bile. Now, the reason I brought that up is because that transporter, it loves to absorb stuff that's already ready-made. So it will normally go for the bile. And the food that you've just eaten is less favourable to be absorbed. And of this, only 25 to 50% is absorbed. So you can see now when that's competing with that and only 50% maximum is absorbed of all this, the amount that you have in your diet is near enough negligible. So that is why you can see why having a large amount of cholesterol in your diet in a large majority of cases doesn't lead to high levels of blood cholesterol, which was a myth that was debunked many years ago. So physiology out of the way, how do we reduce the amount of absorption of cholesterol from the gut? So here we have the intestine again, we've got the cells, and we've got this transporter here, the Niemann-Pick C1 like one. First thing that I would say is fiber. So in the West, we don't have enough fiber because a lot of the food is ultra processed, meaning that is normally void of any fiber. And we should be aiming for 30 grams of fiber. I hope you can actually see this. I don't even know whether you can. 30 grams of fiber each day. The main one that gets brought up are oats. And the reason being is because it's a soluble fiber. So if you think about cholesterol in your diet, whether it's come within egg yolks, red meats, saturated fat components, whatever it's come in, when you have oats, it contains something called beta-glucan. Now, when this beta-glucan comes in, it creates a gel and it basically traps all the cholesterol from your diet and even from your bile salts. And the reason why that's important is if you trap it, it is less likely to interact with this. So we have a reduction in the amount that's absorbed and it will get passed out in your stools. So that is one way, increasing your fiber. And like I said, one of the best ones are oats. And the maximum benefit that you get are about 75 to 80 grams of organic oats because it contains 3 grams of beta-glucan, which is why oats are classed as heart healthy, because they reduce this aspect of your diet. So that's one way to do it in terms of absorption and your diet. Now, the next thing I've got to go on to is out of the intestines and into the liver, because this is where the majority of improvements with blood levels of cholesterol can be made, because 80% of your blood levels originate from the liver making it. So, a bit of physiology again. However, cholesterol is made by like a 27-step process. It is very, very complex, and I'm not going to go into that here. However, one of the first building blocks of cholesterol is acetyl-CoA. Some people may be aware of that, some people may not. If you've done biochemistry, you definitely are. And why this is important is that this molecule is a central role to most of the macronutrients in the body. So you can, from here, make proteins. You can, from here, make carbohydrates. I'll do carbs. And from here, you can make fat. So the inverse can also happen. If you've got too much fat and you need to convert it to energy, you can go that way. So with carbs and even with protein, even though that is a last resort, we do not want to use protein. So that is one of the things that the body will try and preserve. However, this eventually goes through a couple of reactions, and one of the steps I will bring up is the reduction of HMG-CoA. And then eventually it will go down to cholesterol. So that is a very simplistic overview. Now we're going to draw our attention to acetyl-CoA, because if you have a large amount of raw materials, like with anything, if you've got a lot of things to do something, there is more of a chance that it's going to happen. It will then increase this and lead to more cholesterol. So if we can decrease this acetyl-CoA, it will then reduce the raw materials that the body has to make cholesterol. So the question is, how do we reduce the amounts of acetyl-CoA. So this can come down to a bit of energy balance and also with your diet. So acetyl-CoA, like I just said, can come from all these different components. Now in the body, when we eat a meal, so if we have normal activity, so me now doing this, because it's not laborious, I am using mainly fats as energy, gets converted to acetyl-CoA, and it goes into a fancy process, which I'm not going to go through, called the Krebs cycle, the electron transport chain, so on and so forth. Once I start to then increase the requirements, so let's say I went for a jog, it would go past the fats and it would like to use a bit more sugar, which eventually will go to acetyl-CoA. It also has glycogen. There are so many things, but you can see that this is one of the requirements to then go and produce energy in the form of ATP, which is the energy currency of any cell. Now, if you have a low energy demand, so let's say you are largely sedentary, then you are going to not require that much acetyl-CoA. So if you are having more fats and more sugar, there's no requirement to make this, because what is the energy being used for? So the obvious thing for the body is then to either get rid of it in the stools, but once it's absorbed, we want to store it in the form of fat usually. So sugar will usually go to glycogen, and once that's being exhausted, everything gets stored as fat, and there is basically an infinite amount of fat that we can store. So the simple thing is increase your energy output, increase the amount of activity that you are doing to then reduce the storage of fat and all these other things. So that is the first way. The second way is simply by, if you reduce the amount of carbohydrates and you reduce the amount of fats, there is less production of acetyl-CoA, which then reduces the amount of cholesterol made at the very end. So that is why if you are in a high, I will obviously go through tangible numbers now in terms of how many carbohydrates should you eat, how many fats should you eat. So when it comes to fats, we have a few different categories. This is the best way to say it. So you've got polyunsaturated, you've got mono, and then you've got saturated. Now, a lot of people may be aware that saturated fat has a very, very bad name. It does have its purpose within the body. However, higher levels have a higher risk of heart disease, and it's because it has a higher propensity to form acetyl-CoA, which, as we know by now, increases the amount of cholesterol, and then it will be transported around the body and has a higher chance of being stuck within the arteries. So with saturated fat, what should you be doing, or what should you be aiming for? So guidance for many years has been that no more than 10% of your calories should come from saturated fat. That is a good rule of thumb. In recent years, the Americans have adopted a higher risk profile. So if you have, let's say, poor blood markers, you are excessively overweight, or you've got a poor family history of heart disease, then that would even drop to as low as 6% of your total calories coming from saturated fat. And saturated fat, as a rule of thumb, is solid at room temperature. So if you look at a steak and you can see the marbling around it, that is saturated fat. A lot of dairy products contain saturated fat, and a lot of confectionery and ultra processed foods are high within saturated fat. So that is one rule of thumb. Try and reduce your saturated fat down to no more than 10%, because it will eventually get converted to acetyl-CoA and can go to cholesterol. Now with carbohydrates, this is a lot more difficult, because it is all dependent upon muscle mass. It's all dependent upon your physical activity. So there's no arbitrary number that I can give you to say, oh, you should be doing this. I mean, most diets depend, obviously, if it's a ketogenic diet, you are having such a low proportion of carbohydrates. If you are having an average diet, you would probably see close to about 30% of your calories coming from carbohydrates. But what do we use carbohydrates for? Let's go for that. So we obviously use it for energy, which goes into ATP, and we use it, if it's not being used at that moment in time, we will put it into glycogen. Now, glycogen is a term that many people who go to the gym are probably familiar with. It is one of the things where if you go onto a fast for 24 to 48 hours, you will notice a reduction in weight, maybe 1 to 2 kilos, give or take. And that is because you are depleting your muscle of glycogen and water at the same time. So for this is a rule of thumb, rough rule of thumb anyway. So for every 1 kilogram of muscle, you have I would say give or take 20 to 30 grams storage capability of glycogen. So needless to say, if you increase the amount of muscle mass, you will increase the amount of carbohydrates, which then reduces the amount of acetyl-CoA available to go into fats and to go into cholesterol. So this is going to lead on nicely onto exercise and how that impacts it. So the first one is, like I've just said then, if you are increasing muscle mass, you are going to increase the amount of lean mass where we can store these carbohydrates, and we can use a lot of these ingredients without them being converted into fats and cholesterol and being put unnecessarily in places where they shouldn't. The other thing with exercise, muscle mass, for example, there's actually so many things, to be honest. So I'm going to go through the benefits of increasing, how would I put it, muscle mass in the terms of insulin sensitivity. So when you have a low amount of muscle mass or the muscle is inactive, the body likes to store fat within the muscle cell. By doing so, it reduces the sensitivity and the response to insulin within the body, which leads to a term called insulin resistance. And then you have a downward spiral basically of metabolic dysfunction from that point. So why is that? Because when you have an increase in muscle mass and you increase insulin sensitivity, it means that the body is more responsive to insulin. And where this comes in with cholesterol is, if you remember this part, acetyl-CoA, few steps, goes to HMG, and then this, CoA, and then this goes down to cholesterol. Now, the slowest and most important step in the synthesis of cholesterol in the body is this part here, and it's done by an enzyme, just so you know, called HMG-CoA reductase. This enzyme is very popular with pharmacology because this is where statins, a drug that a lot of people are probably aware of with cholesterol, this is what that inhibits. So you then reduce the amount of cholesterol made. But this enzyme, when you are insulin resistant, it increases the activity of this. If you increase the activity of that, you get the opposite. You get an increase in cholesterol. So by increasing muscle mass, you increase the sensitivity to insulin. You then reduce the activity of this enzyme, and it means that you have a reduction in blood levels of cholesterol. Now, the next thing with regards, well, let's go on to how do you build muscle mass. I probably don't look the best at this moment in time. I probably am in my worst shape I've been for a couple of months, but I do have a decent idea on how to build muscle. And everyone's more focused on what is the minimum requirement I need to do to get a return. So when it comes to muscle building, it's resistance training. So the thing with resistance training is the first thing people think of is they need to go to a gym, lift crazy amounts of weights and do certain things that they are not comfortable with. And this is where the barrier breaks down, because when a lot of health professionals give advice on increasing activity, they actually don't give them a minimum effective amount. They don't give them a tangible road plan where they can put these things in and get a return straight away. And that's where a lot of patients then end up coming back and going on treatments because they are too far gone. So with resistance, the lowest amount that we could say where you would get a return, I'll rephrase that, because anything is better than nothing. And that is the same with a lot of things in life. Doing something over nothing, you will get some sort of return. But to have a meaningful return, I would say 2 weightlifting sessions a week. And what you would do in them sessions as a very beginner would be, and I'll break down the terms for anyone who's not familiar of it, is you would do 1 to 2 sets, and you would try and do, I would say, anywhere between 4 to 6 exercises. Now, what is a set? A set is, if you do bicep curls, for example, and you do 8 repetitions, then that is a set. You do that twice, and you go on to the next exercise, which is 4 to 6, give or take. Now, what muscle groups do you do? How do you know where you are starting with in terms of complexity? I would advise anyone who doesn't have access to a personal trainer or doesn't have access to maybe the highest equipment is you should go in and pick the biggest muscle groups. They are the back is the second biggest muscle group of the body. You've got your legs, and then I would sort of pair up chest with shoulders. And if I was you, the best way to pair these 2 up are to do your lower body once and then do your upper body. And in them, you do the 1 to 2 sets, 4 to 6 exercises, and you should aim to basically your goal should be to activate as much muscle mass in one movement as you can. So a squat activates your quads, your hamstrings, your glutes, your abdominal muscles. When you think of pull-ups, again, quite an advanced movement, but if you do some sort of lat pull-down variation, you are incorporating a large amount of the back, so then you are able to build and burn a lot of energy at that time. And the key with building muscle is that you should always, and it sounds a bit gruesome to be honest, but you should always be trying to progressively overload the muscle to the point where it becomes compromised. So the best way to think of it is, if this is a muscle, and yeah, I'll do that as a muscle. If you have micro tears within it, the body has to repair itself. It usually does so by increasing the size of the muscle, and then that is in anticipation that you are going to lift a heavier load each time. So if you do bicep curls with 10 kilos and you can do 8, after time you will increase the weight to the point where the body goes, well, I need to compromise and build more muscle so that is more functional. And that should be the aim. And like I said before, for every 1 kilogram of muscle that you add, it give or take gives you 20 to 30 grams, again, this number can fluctuate, of glycogen storage. And that means that less food and less substances are being circulating around within the blood and being converted into fat and cholesterol and other things where it shouldn't really be needed. So that's the thing with resistance training. Obviously, when you become more advanced, you increase the volume. You can do different types of splits, which are, so I just said do upper and lower. That is the best way to start. Again, it can be with body weights. There are a lot of things on YouTube that you can use. Once you get more advanced, you could maybe do push, pull legs. And these means any muscles that push stuff away from you, triceps, chest, shoulders, pull anything that comes towards you, biceps and back. And then you can do legs, which are obviously self-explanatory, lower body. So there are ways that you can build muscle, and at the same time, a bit off topic, but you should be aiming for 1.6 to 2 kilograms of protein per day. Now, a lot of people will come in and say that should be per lean mass. To be honest, I'm not really that fussy, because a lot of people will or don't normally get that amount of protein, so you might as well have it. Try and get it from whole food sources. I do not have any shakes or supplements anymore because it contains ultra processed ingredients where they are obviously not natural in terms of they interfere with the body in different ways. However, if you can't get it from whole food sources and you need to use a shake or a supplement, make sure you are getting something that is reputable and doesn't have as many ingredients in as possible, because I still feel as though having your protein requirement each day is probably outweighing the risks of having an ultra processed ingredients, because even though we weren't used to them years ago, I feel like the body is slowly adapting to these. So that was resistance training. Minimum effective amount, probably twice a week. The other thing when it comes to activity and muscles are zone 2 training. Something that if you actually go on my YouTube channel, it's probably like the only videos I normally do. And it's because it was something I never done for such a long time consciously. And zone 2, you may have heard of all the zones. So you have zone 1 to 5, and it's basically the level of heart rate that you are getting to during an activity. And why that's so important is, if I draw this graph, how am I going to do this? This is obviously not planned. If I draw this graph and I say this is heart rate on here, so as you go up, it is increasing in heart rate. And if we, how will I do this now? I'm trying to think of the best way to do it. I'm trying to think of like lactate. No, actually, this is lactate and this is heart rate. So as you go up this way, your lactate increases. As you go this way, your heart rate increases. So ideally, at lower levels of heart rate, your lactate should be, give or take, around here. So lactate, if you've ever done any exercises and you get a burn within the muscle, you might have heard of lactic acid. And that is basically where your body can't use enough oxygen to basically give you enough energy that you need. So then it uses all these other reserve functions to then allow you to still move, because it's a survival mechanism. But at the same time, you've only got a threshold in which you can go to, and after a certain period of time, it will become quite painful. But the aim is that you want to increase your fitness to a level where you can exercise at a reasonable intensity without building up too much lactate. And the way we do that is by improving the amount of mitochondria. Again, lovely buzzword that everyone uses at the moment. mitochondria. You want to increase the amount of them, and you also want to increase the functionality of them. And what these are so important to doing are extracting energy from fats and sugar or carbohydrates, and they form ATP through a very complex pathway. But by improving their function, you will allow a reduction in lactate for a higher level of activity. So if you notice, for example, I could maybe run 10 kilometers in, let's say, 45 minutes, and I might be able to carry on, whereas someone might be able to only do 1 kilometer in 10 minutes because they do not have the functional threshold capacity to do so. But like I said there, so the aim is to have low lactate for the highest heart rate you can. However, there comes a point where you will, at a higher level, produce enough lactate where the body can't sustain it. Now, the thing is, when it comes to zone 2 training, is, like I said before, we do want to use fats as much as possible. And the reason being, I will write it down now, is because they are so good at releasing energy. So, a fat releases, give or take, 9 calories per gram, whereas carbs and proteins, but we don't use proteins per se for energy, release about 4 calories per gram. So obviously, because we store a lot of fat in the body, we've got a higher density of energy. If we can release that for as long a period as possible, then it's going to be more beneficial and more efficient for the body. However, that to release the energy has to go through a large process, which is energy intensive and laborious. So if you are thinking about when you are walking, we've got more time. There's more of an ability for us to, there's more time for us to make energy because there's not much of a demand. However, if we start jogging and sprinting, there's less time to remove the energy from this, which is why we go to carbs, and then eventually we make lactate in large amounts. So when it comes to zone 2 training, we are basically training, and it used to be called the fat burning zone. We are basically increasing the amount of fats that we can use for longer to make more energy. And by doing so, we will then remove the amount of fat within each muscle cells, which improves insulin sensitivity. And as I said before, if you are insulin resistant, you make more cholesterol. Right, so that is that one. So there's that. Now, going on from, I've talked about diet for a bit, I've talked about exercise. The next thing with regards to cholesterol and things that you can do at home to impact it are, what was the next thing I was going to say, are meal timings. Now again, a lot of these things will follow a similar pattern. So there's a few common sense things about meal timings. So if you have your meals early on in the day, you are more likely to use that energy. People are more active in the early hours of the day. And then as you get finished with work, you come home, you are more likely to wind down. So there's less of an energy demand. By using the energy from your food, you are then less likely to have it as storage and fats and cholesterol. So that is one reason why, a common sense reason. The next thing is that early on in the day, we are actually more sensitive to insulin. So we have an increased sensitivity to insulin. Sensitivity. I don't know why I didn't spell that correctly. Anyway, so again, we are then more likely to utilize the fuel properly as opposed to putting it into storage. We are less likely to activate certain pathways which increase cholesterol synthesis. So again, that makes sense from that point of view. And if I do not change the spelling of that, it will do my head in. So sensitivity to insulin. Now, there's another thing. So there's something called a circadian rhythm. So circadian rhythms are basically your body's internal clock. And there are things that happen within the day naturally that we just have evolved with. So for example, as you go throughout the day, you have, in the morning, you have a spike of cortisol, which reduces throughout the day. And the reason being is that once you get up in the morning, you need an early boost of energy. So that releases stores. And the one that we are going to draw our attention to now is that cholesterol synthesis happens later on at night, usually between the hours of 12 a.m. and 4 a.m. Again, this is all relative. If you are a shift worker, it will change a bit because your body clock is going to be slightly different. However, on the average person, 12 a.m. to 4 a.m., you are having high amounts of production of cholesterol. And the reason being is because at this point, you should usually be in a fasted state. So if you are not getting it from your diet, the body goes, okay, well, I actually need to use cholesterol, and it then upregulates its synthesis. And that is why if you are taking statin-lowering medication, you take it late on at night, because your drug levels are going to peak, and it is going to be easier for you to have a better effect from that. How do we use this practically? Well, obviously move your meal times further forward so that you are going to be in a fasted state for longer. Fasted states also have the benefits of reducing, again, the hormone that's central to a lot of heart health and metabolic health is insulin. So if you are fasted for longer periods of time, you are going to have a reduced spike in insulin, which obviously a lot of people talk about now. That is one of the reasons why it's so beneficial. And then it also increases the sensitivity, like I've said here, because you're not overusing that pathway as much. Now, is there anything else with meal timings? Again, the only thing I would say with meal timings is if you have the ability to do so, again, it's all got to be individualized. If you can base your meals or your main meals, again, main meals early on in the day, but if you can base it around the level of activity that you are doing. So if you have your main meal, let's say 6 p.m., and that's always before you go on a walk for 10 to 20 minutes, that is going to be better to put it there than to have it at maybe 3 o'clock in the afternoon where you have no activity either side of it. And that's again because there's an immediate demand for energy at that point, less of it's going to be stored. And that is the biggest thing that comes up with not just cholesterol, it is also to do with anything that's related to metabolic health, heart health, inflammation, all these things, is that if the body is not using it and sends all of its ingredients or the majority to storage, that is when you become more problematic. And that is why when you look at all these new medications now, so you've got the GLP-1, and I know I'm going slightly off topic, but it's relevant. So when you've got GLP-1 medication, they do work in a slightly different way in terms of its novel, how it works in the brain. However, the fundamentals of it is that by reducing the amount that you eat, you have to increase the amount of storage molecules that you are utilizing, because with the body, ideally, I'm actually going to touch upon this because it's a common myth, even though I weren't going to debunk a lot of them, is that when the body has an excess of energy and it stores it, it can put it as fat. And as you've seen by probably a lot of these programs, 600-pound sisters, there is basically an infinite amount of storage that we can have for the majority amount of people. And if you have more fat that's stored within, well, let's say this is the skin, there, it's got the epidermis and dermis. If you can store a lot of your fat within the skin, subcutaneous, that is more beneficial for your health. It's not as aesthetic, but it is more beneficial. But there are people who have something called lipid dystrophy. So these are people who may actually seem, some of them actually may appear anorexic, severely underweight. However, they have a lack of fat cells underneath the skin. So what the body does is obviously it wants to store energy. It starts putting it within the liver. It starts putting it within muscle cells. It puts it in the pancreas. It puts it in all these places where fat should not be in. And the best analogy that I can come up with regards to why storage of fat is unpredictable and something that we should be straying away from is if you have a bath like this, not the best bath to be honest, once you fill it up and it comes over this line, it obviously spills out onto the floor. You've got nice porcelain tiles, whatever you've got in your bathroom. And then let's say it comes out the room, it can go into the floorboards. You actually have no say on where that water is going. And every person has their own bath, essentially. So you've got a different amount of storage. So this person may have 100 litres. I may have only 50 litres. So that is why you can't just look at someone's physical appearance and say, oh, well, they've got a reduction in their risk of heart disease, diabetes. It's all dependent on where your body stores fat and what capacity it has to do so. So that is why I had to bring that up. Now, we've talked about exercise, we've talked about diet, we've talked about meal timings. The last one I'm going to talk about, well, the last two that I'm going to go on to is sleep. Now, I am not the best person to talk about this. I don't know too much about sleep in terms of an in-depth clinical analysis of it. However, there's a few common sense things that come from sleep. So if you are more tired, you are more likely to increase the amount of food that you eat. And that is usually to either power you along because you've got a lack of energy due to the fact you haven't restored your body. You've also got the fact that you just feel groggy and you just have a poor ability to make decisions again because you are tired. So you increase the amount of food, which again does many things, increases insulin, it increases fat storage, so on and so forth. They are all the same things. If you have a low amount of sleep, so ideally we should be aiming for, I'd say about 7 to 8 hours. That is a good amount. I mean, I am getting better at the 7 hours. I'm probably closer to that 7 hours than I've ever been in my life, to be honest. But I am pretty poor with it. I don't even know why it is. I think it's because I just feel as though if I stay up later in the night, I just get more out of my day and more things that I can go through. However, you should be aiming for that each day because I've said it so many times, sleep is that fundamental that even when you are at risk, so if I was still in the wild and we were hunting and I need to sleep, I am most vulnerable to attack when I'm asleep. However, we've not been able to shake the ability to not sleep. So it must be so fundamental that we need to do it because it's not being able to out-evolve it throughout the whole of history. Anyway, if you have less than 4 hours each night, that has been linked to increase in insulin resistance. And as we said before, insulin resistance plays havoc on the whole body. It increases the amount of fat stored in the wrong places. It increases the amount of cholesterol for the purposes of this video. And downstream obviously is not beneficial. So they're the main things with sleep. And the last one is that you are more likely to be, a lot of patients or a lot of the public, increase in anxiety or stress, which is the last part I'm going to discuss with regards to actionable things that you can do. Stress is, and something that I always say, is probably one of the hardest things to look into from a physiological point of view. So if you have stress, everyone knows, and it's normally the common thing that you'll hear, oh, it's because they're stressed, and no one genuinely doesn't understand how complicated stress is as a response. I will say stress gets a lot of negative press. Oh, I've got to stress my arm here. But in reality, without stress, people who do not have adrenal glands and they come for surgery and they do not have the right amount of steroids, they would basically die within hours if you didn't have the right amount of stress response or stress hormones. So like with everything, it's all in a balance. We need to have enough of it. But the issue with stress is when it is chronically elevated at low levels for no intense reason or purpose. So the reason why stress is so bad when it comes to metabolic health is that it increases the hormone cortisol. Now, a lot of people on social media talk about this hormone, and I don't really talk about it too much because the funny thing is I know what I don't know. I know quite a lot about this hormone, and people who are on social media, in my opinion, don't have a clue about it, and it is so complicated. But one of the main things with cortisol, like I said, if you are thinking about time of the day, morning to evening, and you've got levels up here, cortisol spikes very early on in the morning and will slowly come down. And the reason being is that cortisol's, one of its main actions is to mobilize the amount of resources that we have in the body. So it increases the amount of sugar, amino acids, and fat or fatty acids that we have available within circulation. But the issue with this is that it is so complicated because you would think, okay, well, if someone's got a lot of sugar within the body, it might mobilize it from already stored sources. However, it increases the amount of production from the liver, and it is so counterintuitive that I still fail to understand this hormone in its entire complexity. But the thing is, like I've just said then, it increases the amount of these molecules that are available. And a common theme is if you have a lot of raw materials, if you think about any reaction, any raw materials, I'll write it out here. If you've got more of them, you will get an end product and you will have more of it. And that is the same thing in a lot of general life situations. And with these raw materials, the sugar, the fats, the amino acids, you now know that they can all converge to a molecule called acetyl-CoA. That is central. And if there is a molecule that you want to look at with regards to metabolic health, I would say acetyl-CoA, and another one that is basically linked to it is citrate. And any excess of this or sugars go into citrate and they sit within cells until there's a point where they're not needed or we want to cleave them back into other forms. So that is the thing with stress. It is very complicated. However, it is always a good way to reduce the amount of stress that you have. Now, how do you do that from a practical point of view? Obviously, some people might be stressed. The fact that I've just told them to reduce the stress and I've not given them any means to do so. So the ways to reduce stress, breathing is a very good method. Now, a lot of people would advise to do the box method, which is you inhale for 4 seconds, hold it for 4 seconds, exhale for 4 seconds, and then hold that for 4 seconds and repeat it maybe like 5 times. That is a good way, but you can actually do it yourself. So when you hold, I'm going to just actually double check this now before I give the thing out online. So when you exhale, you actually lower your heart rate, and that's usually through the vagus nerve. So when people are hyperventilating, they would normally see a higher heart rate, which will obviously lead to higher stress, perceived stress as well, because stress is psychological, but it has a lot of physiological. Stress isn't psychological. Everyone thinks stress is psychological. However, it has a larger physical underpinning than a lot of people give credit for. And that is why when it comes to treatments, we normally give beta blockers for people who are highly stressed or anxious, because it reduces one of the signs, which is high heart rate and palpitations. So breathing is a big thing, and that sort of ties in loosely with meditation. So being present, actually engaging with something where you can try and remove any factors out of your brain. Easier said than done, but breathing is definitely one of them, because once you are conscious of your breath, because I'm not conscious of it now, but if I were to be, I can only focus on breathing for at least a few minutes. So that is a good way to de-stress. Another one is walking, ideally within nature. And there are loads of different things as to why nature is so beneficial. There are things that I seen the other day in terms of the frequencies of birds, the way that they sing aligns with common frequencies within the body. That's how sound baths work, which is another way to, again, de-stress, massages, etc. But nature is something that we all play on, because if you open up any laptop, you will see it as most screensavers. And that is just because even in isolation, even in a room with no windows, if you can see nature, it just gives you that calming effect. Whether that's got a deeper meaning because we are meant to be more spiritual, I don't know. And that is not what I'm going to go into here. However, taking a walk and trying to do it more in nature is a good thing to do. Other things that you can do, and again, I don't follow this, so don't take my word fully for it, but journal. Always a good thing to do. Write down all your issues on there. You can see it in black and white. It may give you greater perception and clarity on certain things. Obviously, speaking to people if you've got that ability, because I always obviously give this advice out, and I'm probably the worst at it. A problem shared is a problem halved. I've probably done it once, maybe, but that is definitely one thing you should do. One thing I have started doing is making a to-do list. These sound very simple and primitive, but if you've got a lot of things on and you can just write out a few things where it's like, okay, well, I don't need to really hold on to that because it's on paper. As long as I don't lose that piece of paper, I've got a good idea of what I need to achieve today. And if I set my expectations more in line with reality, then you're going to get a better return from it. But they're the main things with stress. Like I said, massages, doing the things you want to do. We live in a world where a lot of it has been depicted and dictated for us, where you've got to go to work for certain hours, you have to do certain things you don't want to do. From time to time, you are entitled to do your own thing. You do have freedom of speech within a large proportion or a large population within the world anyway. So that's one thing you could do. So the things I've went through are diet, before I go and have a look if there's any questions. Exercise, I can't even think now. Exercise, we've got sleep, which I've just said. We have meal timings, very similar to, probably loosely ties in with diet. And then we have stress. If you have all of these things in order, you will not just reduce your cholesterol, you will also improve your metabolic health, you will improve your blood pressure, you will improve your inflammation, you will improve all these other aspects and improve your long-term health. But I was just giving you an overview of what you can do with regards to improving something without going on to medication, and actually giving you a roadmap for that. There was actually one thing that I've not said, because I've given everyone like a minimum effective amount, where if you go and do this today, like I said, anything is better than nothing. But if you go and do these, you will get a decent return back. It was down to zone 2. So zone 2, how do you know whether you're in zone 2 and you do not have a fancy heart rate monitor, which I don't? You can do, what's probably the best way is, you can do 2 things really that will give you a good idea whether you're in zone 2. So you can do the talking test. So this is where if you were to phone someone and you were jogging on a treadmill, you were briskly walking, and you are able to exercise to a point where you can hold a conversation, but it shouldn't be as comfortable as I am now doing this on the live. It should be to the point where you can just about hear that I'm breathing, slightly out of breath, but I can hold a full conversation. I can speak in full sentences. At that point, you are using the maximum amount of fat for your energy. Any more, you then start to shift away from fat, and then it doesn't train the zone 2 pathway, which is a key, because a lot of people think I'll just go for a fast jog and I will train zone 2. Yes, you will get some benefits, but it won't be as efficient as doing it this way, and that's what it's all about, efficiency. The next one is the breathing test. So the way you do this is the breath test. So if you are able to exercise doing your chosen modality, whether that be rowing, cycling, swimming, whatever it is, and you can breathe doing the exercise through your nose, but it is just on the border to need to breathe orally, then that is a good marker for zone 2, being at the top of zone 2. And like I said, zone 2 is the maximum point at where you are using fat here. And at that point, it starts to drop, and then you start to use more sugar, glycogen, pyruvate, all these other forms of energy. So they're the 2 ways that you can see whether you are in zone 2 if you do not have a proper heart rate monitor. And if you do have a heart rate monitor, they are pretty accurate. However, you've got to be a bit careful with them and exercise a bit of caution, because some of them may be inaccurate. Now, what do you need to do zone 2 wise? Now, the gold standard is 150 minutes and to be done in about 45-minute sessions each. So that is the gold standard. And this is of a week, by the way. I'll put that as weekly. So if you hit that each week, again, along with your strength training, and then there's other forms of training to do. There's mobility, there's all these other things. Again, I understand that there's a lot to do. However, the body and health is a priority, which a lot of people don't see it as. And I would rather do 150 minutes on a bike each week than do 150 minutes on a hospital ward where I've got a drip in me. So that is another perspective to have. So that is what the gold standard is. However, again, doing something is better than nothing. But there have been reasonable, I would say significant improvements when people are doing 60 minutes a week. And that is even just doing about 10 minutes each day. And what is zone 2? Like I said, once you find out where you are at here, that could be different for everyone. So for me, zone 2 is I sort of have an idea of when I do a cycle or when I do a jog. Me at zone 2 is, I would say, I think it's like running each kilometre, I want to say 5 minutes 30 to 45, give or take. It might have changed since I've had this cold, but that's where I normally sit for zone 2. But for someone else, that might be doing it at 4-minute kilometers. It might be doing it at 10-minute. It might be even just walking because you've got no level of fitness. The whole point is that if you do it for 5 to 10 minutes each day, you will see a massive return when it comes to your physical fitness, but also your metabolic health, which is the biggest thing here. Now, I've gone through basically everything that I want to go through. I will just go behind the camera to see if there are any questions. I do not know if there is. And I will go through them as much as possible. If I can even see. Oh, I actually can't even see. Right, I actually can't even see if there's any questions. But I need to try and find a way in which I can, because there probably will be. Right, how do I... okay, I can see them now. Oh no, it's okay. Love the uniform. Okay, so, actually, yeah, could I have a phone? Please. Right, I'm going to do questions now. Thank you. It's like art attack here, isn't it? Right, so let's go through them. So, love the uniform. Thank you. Well, it's a bit different, actually. I needed to do more. Okay, yeah, I'm back in the picture now. I needed to do more of a uniform because it literally just looked as though I was going to the gym on a large majority of them. However, serum triglycerides 1.2, serum HDL is 0.9, LDL 4.3, HDL ratio. Okay. Here in front of me, can you tell me to check things that can help if I'm healthy range or not? So I'm not going to go fully into individual results per se, but using this one here. So like I said at the very beginning, I've got a red pen now. Like I said at the very beginning, if you have a blood test, you will normally get the following done. You will have total cholesterol, and you will have LDL, not the best pen. You will have HDL, and you will have triglycerides. They are the main forms that you will get checked. And a lot of people focused on total cholesterol. The UK loves it to be less than 5 millimoles per litre. That is what we like it to be less than. LDL, depending on where you are, we like it to be less than, give or take, 3 millimoles. And then HDL, we want it to be greater than, give or take, 1.2. And triglycerides, we want it usually less than about 1.7. So they're like the usual ranges that we go off. However, like I said, all of these, I'm going to use a different pen because I don't like this one. Like I said, all of these, this total cholesterol only accounts for 10% of your whole body cholesterol. And this is where my sort of point of view comes in. So a lot of people are very scared with reducing the level of cholesterol within your body. And the reason being is that cholesterol, which I haven't actually went through today, which I will go through now. So cholesterol is used for many different things. Like I said, there are so many things that we take for granted with cholesterol, and it's probably why people are so concerned with it. So it is used in the cell membranes. So each cell looks like, let's say like this. It has an extra layer, which is the membrane, and it's got loads of fats here. And what cholesterol does is it comprises about 40 to 50% of a cell membrane. And cholesterol affects how flexible it is, how fluid it is, and it also gives it the ability to communicate with other cells. So that is why it is essential for cell life. If we don't have enough of it, then we wouldn't really have any functioning cells. Now, the other reasons why cholesterol is so important is it has a wonderful structure. I do not know how it is exactly. It's got so many different carbon rings anyway, pentose, whatever, hydroxyl. It's a massive structure, and this shares the same backbone as vitamin D. You've got estrogen, you have testosterone, you have aldosterone, you have cortisol. So these are all pivotal hormones for human life. So people are scared that if you reduce the amount of cholesterol, you will then reduce the access to producing these hormones, which I can see the concern. And then another main benefit of cholesterol is when you think of a nerve, so you've got your brain here and you've got your hand here. Like I said, if I want to click my finger now, I've just thought about it and it's actioned within milliseconds. How does that happen? Well, after it's gone to here, so it normally has this into the central nervous system, whatever. It has these things on it called myelin sheath. And why that is so important is if you didn't have myelin sheath, it would have to travel all the way down here and it would take longer. But because of the fat, which is made up of cholesterol, it can jump very quickly. It's called saltatory conduction. Now, going back onto, I needed to bring that up to show why it's important and why people are concerned, why you lower it too much kind of have a detrimental effect. Like I just said then, every cell can make it. We don't use it for energy, but because it's only 10%, you've got enough energy, you've got enough cholesterol within the body to actually support these issues. And there are groups of people, usually within Africa actually, who've had this gene where they have low levels of cholesterol. So the blood results that are in question here, so a level, HDL level of 0.9 and triglycerides, so 1.2. Again, this is, I have to say this is not medical advice, by the way. If you've got triglycerides at 1.2 and you've got a HDL of 0.9, obviously that's within range. That is slightly low, could be due to a different reason. However, the one thing I would look at is that this is lower than that. And ideally, I would like HDL higher than this. And that is because it shows that the body is more insulin sensitive the higher this is in comparison to that. So that is one thing I would look at with comparison to them bloods. Now, let's see, I'll go into this one. Does the ketogenic diet cause heart disease? Now, a lot of people come up with all these different diets and a lot of people have a lot of benefits from them. With the ketogenic diet, the whole premise in which it works is that you reduce the amount of carbohydrates to the point where they are negligible within the body. The body has to use fat. The body can, or the brain and the body can survive on fat because it makes it as ketones. Now, I feel like with any diet, as long as it is whole foods and it's coming from real sources and you're getting enough exercise and you are doing all the right things, then you are going to be pretty healthy with a lot of diets. That could be a fully vegetarian, pescatarian, omnivore. I wouldn't really focus too much on individual diets. Right, so let me see this one. About saturated fat, is natural butter an exception? I've seen as part of some keto diets as high as 25% of daily calories. So this is the thing. So when you are on these ketogenic or carnivore diets, you are going to have a higher level of fats as a part of your lifestyle. And the issue with that is a lot of people actually get a lot of benefit. And my sort of hypothesis behind it is that because a lot of people now have a lot of ultra processed foods, I don't even have any to show you, to be honest. Actually, I do, because it's the only one I have. The only ultra processed food that I have within my diet, oat milk for a coffee, because I'm lactose intolerant. But obviously you can probably see on here there are so many ingredients which would normally just be milk. Now, when people within the US and Western cultures are eating their normal diet, you will normally see the average person having about 60 to 80% of their calories coming from ultra processed foods. So the fact that you're eating all these ingredients that the body may not be able to even recognize, and then going to a carnivore diet or ketogenic where you are eating whole steaks, you are having butter, you're having real food, you are going to feel 10 times better. My only thing is because the carnivore diet and all these other types of diets are only really being popular on a mass level for the past, I would say maybe 3 to 5 years max, the evidence around does it increase the level of heart disease is going to be one of them things. But like I said at the beginning, cholesterol is only one string to the bow. So in terms of a heart attack or heart disease, stroke, I think it's safe. I think it's good that I actually go through a slight bit of the process. So this is an artery wall. So these are, I can't even see my veins today actually. But anyway, that's your artery. And you have, let's say, your muscle cells here. You've got other cells of the body. So when you have anything in the body, it's got to transport through your blood. We're obviously very well aware of that. That's why it's basically the road network of the whole body. So you will have things within the blood. So here we go. We're going to do cholesterol here. Nice cholesterol. Now, for it to get out, sometimes it will get trapped within the wall of the artery. Like I said, every cell usually has a membrane. So when this goes through to go to other cells, it may get trapped into this part called the subendothelial space. It will bind to things called proteoglycans. And when it's in here, that is when it causes havoc, because you will get the immune cells called macrophages that will come in, try and eat them. And once you have that causing an inflammatory response, when you have blood pressure damaging the artery wall, once you have smoking damaging the artery wall, it will then lead to this big plaque being formed, which then, as you can see, once I draw it properly, it'll have a big plaque formed where the blood flow can only go through here as opposed to all this space here. And then a reduction in blood flow or this clot comes off, it can trap and dislodge within an artery, and that is when you have the biggest concerns. But as you can see, cholesterol is only one of the perpetrators. It needs to have endothelial damage through high blood pressure, smoking. It can have high levels of inflammation. These are all the things that are leading towards heart disease. So in someone who is a carnivore or leading a carnivore ketogenic diet, they may have high levels of cholesterol, which the best analogy to say is if you've got a road and you have two cars on it, which is more likely to crash, the two cars or having 8 cars, which one's more likely to crash? Obviously it's this side. However, there are things that need to happen for a crash to happen. So if all these are proper drivers, there's no poor conditions, then there's a good chance that they won't crash. So, and that's the same with cholesterol. People who are leading these ketogenic diets tend to be more conscious of the health because they're actively doing something. So they're more likely to be more exercise savvy. So they are reducing all the other risk factors. So it's not something I'd be concerned about in its own right. But having a high level of saturated fat, as you can see, leads to high cholesterol. Right, so let me have a look at this. Stress management is also an important factor and linked to its sleep. Exactly, like I said before, stress and sleep, we have not been able to out-evolve sleep. And when you think of everything else that we've done, the appendix, all these things that we can out-evolve, we haven't done that with sleep. Masterclass, thank you very much. Very well done. You seriously need to get your PhD. Yeah, okay, thank you. A 10-minute walk after each meal or even the biggest meal can help with insulin levels. It can. And obviously there are things that can do more for that. However, like I said, it's all about energy balance. The whole body and health is actually pretty simple in a large majority of cases. But it's not as simple as this. But if you have high levels of energy coming in, then you need to make sure that you have high levels of usage. If not, then because the laws of physics, I think this applies, energy cannot be created nor destroyed. So it's got to be used or stored, essentially. So it's got to go somewhere. And it will normally go in as fat because that is the body's primary way of storing excess energy because it is just so easy to compactly put into certain cells and there's an infinite amount. But yeah, 10 minutes after each meal, that is a good thing to do. And I try and do that as much as I can. Let's see what else there is. Thank you very much. My doctor's telling me to start taking creatine. I'm going to help. I will probably do a video on creatine. I'm going to look into it a bit more. Do any of my results show metabolic issues? Okay, so because we've got a bit of time, I'm going to go back towards them results. So, like I said, not medical advice, but we've got triglycerides are 1.2, I think they were. You have HDL at 0.9. I'm also going to go through what these mean. So for anyone who's wondering what is a triglyceride, what is a HDL, I'll go through that now so that you can obviously look at your results and be like, okay, well, this needs to get looked into in a bit more detail. Let's say serum is 0.9, LDL is 4.3, and non-HDL is 4.8. Now, going back to the basics, let me just have a quick sip of water whilst I talk about it. But cholesterol is like a fat, and when you get any fat and you put fat within water, it doesn't mix. And that's the same with cholesterol. It's classed as something called hydrophobic or largely hydrophobic. There might be people out there saying it's amphipathic. It is. But largely it is hydrophobic. So we need to make sure that it is being transported in the body attached to some sort of vehicle. So what we need to do is we put it within things called lipid proteins, lipoproteins, which are what we've just discussed there, which I'll just have a quick sip. So it needs to go transported around. So if you think about it as each cholesterol molecule has to go round within a boat. So there's the cholesterol. It's got to go round in boats. And these are the boats. They're not. That's just a measure of fat. I'll come on to that. Now, what the boat is doing or where it's going is the most important thing. And people will say that HDL is good cholesterol and LDL is bad cholesterol. There is no such thing. Cholesterol is the same. You can even see it here. I've drawn it. The only difference is that This LDL cholesterol will have a different tag on it or a different flag, and so will the HDL. So it's the particle that it's within, it's the transport, it's not the cholesterol. Cholesterol stays the same in both of them. Now, LDL cholesterol usually goes away from the liver and it goes towards the tissues, whether that be muscle, it can go to a lot of tissues in the body. And the reason why it's classed as bad cholesterol is that on its way from the liver to the muscle, there's obviously more complexities to this, but it can have a higher chance of being lodged within the artery wall, like we said before, and causing that plaque, which is obviously not good for us. Now, HDL is classed as good because it does the opposite way. So it normally takes stuff out of the artery and helps it on its way back to the liver so it can be processed. Well, that's really, really gaseous, that water, but it helps it be processed to a greater extent. So that's what a lipoprotein is. So we are looking at basically where our risk lies. Where is that protein? Where is that cholesterol going to? How is it getting used? Now, like I said before, LDL of 4.3, we would like it below 3. And if you've got a history of heart disease, family, we would obviously like it to go as close down to maybe 1.7. So if you've got no history of heart disease, then you can have it closer to 3. However, this is not the only thing we should be looking at. We should also be looking at inflammation, muscle sensitivity to insulin, fat mass, abdominal mass. These are all the things that you should also be looking at in partner with these. But LDL is a bit high in this case. It is something that I would try and lower a bit more. Now, triglycerides are fine. They are below the 1.7. There's nothing that really stands out here to me where I'm thinking, okay, that's not the best. HDL is a bit low. Now, ideally, depending on where you're looking, I would say anywhere above 1.2. There's a bit more nuance to HDL. It's got a few more complexities to it. However, in this case, I would say the person potentially has a higher level of saturated fat in comparison to polyunsaturated fatty acids, which are your healthy fats. So these are more like your, let's say, your avocado. These are stuff like your olive oil. These, not your polyunsaturated, but your fish oils, for example, with omega-3. So that is where that is. So I would say this person has, or yourself, has higher levels of saturated fat than the healthier fats. Non-HDL, again, I would ideally have that less than 4. A large majority of it has come from this. They're not concerning. I have got a lot of people who are in worse situations. However, there is a lot of improvement that can be made, and one of them could be reducing saturated fats and increasing the amount of energy intake that you do on a daily basis. So that is a big thing. Let's see. Is the Mediterranean diet the one? Okay, I'll come on to that because I heard the type of LDL matters too. Good one. It does. So how would I measure this? So when we do an LDL, so let's write that out again. So like I said before, we would like it to be less than 3 millimoles per litre. That is the concentration. So I'm trying to think of how I would explain this. I've used it in cars before, but basically that doesn't tell me how many particles that's in. That just tells me how much cholesterol is attached to an LDL particle within my blood. So that could be in, that 3 millimoles could be within 100 particles, or it could be within 2. Now, based on the fact that you know what I've said, that heart disease starts when these particles of cholesterol collide with the wall and get lodged in there to cause a reaction, would you prefer it to be within 2 molecules or 100? Now, the answer would be 2, because if you've only got 2 cholesterol molecules there, you've got less chance of them hitting the mark or hitting the wall as opposed to having 100 of them. So this comes onto that question in terms of the type of LDL being an issue or being important. So that tells you how much cholesterol is attached to them particles, but it doesn't tell you how many particles it's contained within. Now, when you think about heart disease, you've got this is the artery wall, the thing I've been drawing for a while, but I'm going to blow it up a tiny bit here. So you've got these cells, and if the cholesterol is bigger in comparison to smaller, the bigger one has a less chance of passing through and being blocked to cause the reaction. If they are smaller, you have a higher chance of them passing through and being lodged here, which will lead to increased risk of heart disease. So that is why, I think it was Anonymous, said the type of LDL matters too. So if they are small, they have a higher ability to cause heart disease. But not many, pardon me, not many labs, especially within the UK, even in the US, really measure the size of a HDL, LDL, VLDL. They don't really measure particle size. So one way around that, which gives us a better risk marker, which is becoming more and more available, is something called ApoB. Now, like I said, I've got a sore throat, so bear with me with the coughing. Pardon me. So ApoB doesn't measure the cholesterol concentration. It measures the amount of particles the cholesterol is within. And based on the fact that you now know that if you've got more particles, you've got a higher chance of hitting the artery wall. It's the same with if you go to a roulette table. If you put down 10 chips, you've got a higher chance of winning something as opposed to putting down the same amount of money on two numbers. So that is the same thing. And ApoB will give you a particle number, and it will then give you a greater risk because you've got a higher probability, or you've got a better knowledge of working out what is the collision rate. It's not going to give you a foolproof sort of answer, but it's giving you a better idea. Mediterranean diet, I'm going to go back to that now. So is it the real gold standard? The Mediterranean diet's obviously really good. What does the Mediterranean diet contain a lot of? It contains everything. So it's obviously got lean meats. So lean meats obviously have lower saturated fats. They don't really use your butters and that as much. They will normally go to olive oils, which normally has omega-6, which are your monounsaturated fatty acids. Again, better because they have a lower tendency to be converted into cholesterol and other fats, so that is why they are better. Other things they have a lot of fiber within them in the forms of legumes, lentils. And when it comes to carbohydrates, they don't have them in refined forms like we do. So if you think of Italy, they'll have whole grain, or they'll actually have real pasta. They don't really have it as like readily available sugar. And when you actually compare the eating habits of the US, the UK and France, for example, this was back, I think it was about 5 to 6 years ago. I don't know the exact date, but if you think of ultra processed food, and like I said before, that is any food ingredient or item where it's got something in that shouldn't be within there. So if you are having apple juice, it should just be apples that are being juiced. If you have apples plus stabilizer plus a preservative, then the stabilizer and preservative shouldn't be there, but we put them in there. And I give ultra processed food a bad reputation, but without it sometimes it wouldn't really be sustainable for the amount of people within the planet. So for example, if we were to go into a famine, we could still manufacture food that would still supply us with the energy to survive. However, it just wouldn't be optimal for us. But for ultra processed food, the UK has, give or take, the average UK adult consumes about 65% of their total daily calories from ultra processed food sources. And that is the UK. The US, for once of chances on this one, it's about 75 to 80, give or take, on the numbers that I used a few years ago. And then when you look at France, which I was very surprised at, France and a lot of the Mediterranean, about 14%. Now, when people ask me about why the Mediterranean diet's so good, a lot of it is due to the fact that it is real food. The body is programmed to eating real food. So if you go back to that, even if you think of Eskimos or you think of all these other different types of diets, a lot of it revolves around the fact that if it's real food, you're going to get real outcomes. So that is why I would think the gold standard is that obviously it comes with a lot of, like I said, organic foods where they are lean, they have healthy fats. So that is one reason why the Mediterranean diet is still the gold standard. Southeast Asia normally has a good reputation as well. They're largely vegan, but they have a good mix. And when you think of omega-3, for example, the Mediterraneans do quite well. England's actually not as bad as you think, and Japan is normally near the top with their things. Did you learn all of this with Anki? I don't know what Anki is. Such a huge amount of info to memorize. I mean, to be honest, so my background for anyone who doesn't know, so I have now been working within healthcare for, is it 10 years? 10 years. So I qualified as a pharmacist. You have to do your university's the degree for 4 years. You do a year in a hospital for about a year. And obviously my expertise is within prescribing, how medication works. But as you can understand or probably see now, a lot of the processes where medication works, because it's on a natural pathway, you can then understand how other things intercept with that. And then I've done a few diplomas with a lot of things. But over the last 2 years, the level of care that I've seen within national health systems, I've merely been just to keep the boat afloat. And if you give the people the right education, so I actually give this education event with a bit more to it in terms of complexity, and I discuss the medication involved in cholesterol. I gave this yesterday with my wife to a set of GPs within the UK, and being honest, they didn't actually know a lot of it, and it's because the way that we are guided with guidelines and the education that's out there for lifestyle and other deeper dives within physiology where it's going to have a meaningful outcome is limited. So over the last 2 years, I just sort of gone into it a bit more, and yeah, because I've went into it that much, it's sort of become so ingrained within me that I sort of can reel it off as much as possible. Flashcard app. No, yeah, so it's just all self going through research papers and seeing them that many times that you just become so used to them. Right, so how to fix this, Lee? What diet do you recommend? But don't you need junk? What diet do I recommend? I mean, I go off my diet. So my diet is, what is my diet at the moment? I would always advise, let's be honest, no human's ever going to live forever. So that's the one thing that we need to sort of bear in mind, is that no human's living past the age, on average, let's say, 75? I actually seen a paper the other day where the average UK adult now is about 61, which I need to double check that, but it was very low. But anyway, we're not living forever, so you need to balance up what is going to improve your quality of life in the meantime. For me, I have a very low tolerance to risk because I've worked in healthcare, I've worked in hospitals, GP surgeries. I want to spend as little time within a disease state as possible. I've seen a lot of family members suffer poor diseases and early deaths where it's just been unfortunate. So that is why my level of risk is quite low, and I want to try and optimize my health as much as I can. But at the same time, I do need to recognize that I can't be perfect within the diet, because let's say in a few weeks' time, if I go on holiday and I need to eat a meal in the airport, there's a good chance that it's going to have an ultra-processed ingredient in it because it's had to have some form of shelf life. But obviously it's better to eat than maybe not eat for so many days or whatever it is. So my recommendations would be to have 80% of your food as 80% of your diet, by the way, from a whole food source. And that is exactly what it is. If you are having tomato soup, it should just be made up of tomatoes, water, maybe a bit of salt. It shouldn't have xanthan gum. It shouldn't have polysorbate 80 in it. It should have what you think it should have. This bottle of water should just have water within it with the minerals that it should come with, which it does, thankfully. Yes, plastics, I'm not going to go into microplastics, but that is what I would advise. The other 20% is going to be conceivable towards ultra-processed food. And if you follow this, there's a higher chance that you're going to get such a good return from that, because there's a good chance you're within the normal population where you're having maybe 40-50% of your daily calories coming from ultra-processed foods, which are void of fibre, and not having enough fibre reduces your bowel habits. It also reduces the function of the microbiome, which is obviously very important. So that is one thing I would say. The next thing with regards to diet are try and have periods where you are having a fasting state. So I had my last meal at 6:45. So my last meal at 6:45 p.m. I will have my next meal, give or take, 11 p.m. So we're looking at very close to about 16 hours. where I will be in a fasted state. So that has given my body a bit of a rest from insulin, and it's just giving it enough time to clear itself up, use its own energy stores, reduce the amount of need for fat. And a lot of the conditions within the body, by the way, and I will come on to a few other questions if anyone's got them, by all means fire away, is you want to try and reduce the amount of fat that we have, because fat was a survival mechanism from years ago where we didn't have enough food. We are now living in an age where I can go into the fridge, I'm very fortunate, and I can pull out most foods and eat it straight away, and I am more than over satiated with energy. And because we've got that ability now, muscle mass has become more important than ever. Whereas years ago, if you had a lot of muscle mass, it was not something we wanted, because as we know, muscles are metabolically active, meaning that at rest, they are burning more energy than a fat cell. And that's the same analogy. If you get a big, massive 8-litre car and you've got a 1-litre hatchback, which one is going to burn more fuel for doing the same speed and the same journey? It's obviously going to be the one with the bigger engine. So that is why muscle was not favoured years ago. But now, in order to survive a healthy life, we need to ensure that we are having enough muscle mass. So that needs to be incorporated within the diet. So 80% whole foods, max 20% ultra processed. You should be aiming for 1.6 to 2 grams per kilogram of protein a day. Now, I said before about lean mass. If you are obese, and when I mean obese, if you've got a large amount of body fat, I would probably go on the lower end, because it would mean that a lot of your mass is due to fat as opposed to muscle. So less of it's going to get built, and eventually all the protein will either be excreted through your stools, through your urine, or will be converted to fat. So 1.6 to 2 kilograms per protein each day, that is essential. The next one is fiber within your diet. So this is also, all these diets can be an omnivore, it can be a vegan, a pescatarian. I don't want people to really get too bogged down on the fact that you need to have a ketogenic diet. You just need to have a diet where it's going to suit your lifestyle, you're going to enjoy it, because food is an enjoyable experience. It's what we've bonded over for years, millennia. So you need to make sure it's enjoyable, but also that it provides your body with the right nutrients. So enough protein, enough whole foods, 30 grams of fiber a day. Now, this is something that a lot of people will not have. The average person in the UK, I think, has about, it was 10 grams of fiber, 3 times less. And that's because of the ultra processed components. Like I said, do not go from 10 to 30 grams in one day. You will be sitting on the toilet, you will be suffering with a lot of abdominal pain. Make sure you do so gradually. Maybe go to 15 grams for a week, 20, 25, 30. Fiber comes in many forms. It comes in soluble, it comes in insoluble. The best way to get fiber is try and aim for 30 plants a week. Now, when I say plants, it doesn't actually mean go and buy some from B&Q. It means such as a spice, cinnamon can be a plant. You've got turmeric, it can be a plant. You've also got broccoli, all these things. Try and incorporate 30 different plants each week. It will give your body enough diversity from a fiber point of view, but also these contain many other benefits that we are only just scratching the surface with. So you've got polyphenols, a lovely word that a lot of people like to say. You've also got phytochemicals. So these are the things that give colour to the food. So when you've got purple broccoli, for example, or you've got dark beetroot, all these things, these are all beneficial for you in the long run. So I just thought I heard a beep, but either way. Protein, fiber, ultra processed food to 20%. Fats, don't be scared of fats. Like I said, try and limit your saturated fat in the average person to 10%, no more. But make sure that you are getting enough of the other fats. So your omega-3, your omega-6. Yes, people will come up. There is a big thing about this ratio. Ideally, you want more omega-3 to omega-6, because in the body, omega-6 has a higher ability to cause inflammatory molecules, where omega-3 causes lower or reduces inflammation. However, these are more beneficial than having more saturated fat, in my opinion. But that is how it would look for me. I normally do it in 2 to 3 square meals a day. I do not snack. And then it's all about manipulating it towards your terms. So for example, today my exercise was a 5.5, 6K run. and I've done a bit of arms after it. So that is what I would advise there. Now, let's see. So that is what I would do for a diet. That is what my diet is. 2 to 3 square meals, all whole foods as much as I can. Oat milk is the only thing that I really have. Let's see what else we've got. Do you think 10 or 20 from now? Oh, there, let's see. Do you think in 10 to 20 years from now we will learn things that was meant to be good or actually bad for you? Of course, that is always the thing with health. We will always find stuff. That is the whole point of science. Same with a lot of things. We do not know the actual answer. We cannot be categorical about anything apart from death. That is the only thing. Very morbid, but that's the truth. B12 is, but it's actually no. Yeah, so again, I will probably go through more of these in later videos. And then, isn't it bad to eat at 11 and then go to bed? Yes. So diet's 95% processed. And like I said, late night eating is not the best for you for a few reasons. So it's just because, just from a practical point of view, are you more likely to use energy later on in an evening, or are you more likely to store it? And when you start storing it, that's when it becomes the biggest issue. Like I said before, you are less sensitive to insulin later on in the evening. So many different things. Always try and do it around your actual routine. So I'm just double checking to see whether anyone else has any questions. By all means, this one is mainly focused on cholesterol. I forgot that is actually going to be playing back as well. But if you have any other questions, by all means, fire them away now. If not, I will start to close it up. Really hope. Thank you very much for the comment. But yeah, so just for context, I did actually deliver this, like I said before, to GPs, just without the medication part, because a lot of people who are listening to this won't be on that type of medication, so it's not applicable. There are other things that I'm going to be going through, so I would like to go through, if this is of any use to anyone, I would like to go through insulin resistance as a next video on a live, just because that is, in my opinion, the biggest cause of why we have poor health within the Western world anyway, is because insulin is being overactivated. And like I've said many a times, when that is overactivated, insulin wants to store stuff. Storage, when it comes to health, is not normally a good thing, especially when we've got a lot of things to store. Years ago, yes, not at the moment. What is your idea of a perfect lifestyle? Okay, that is a good question to end on. And then, like I said, any ideas, I will put them in a group or on a post tab that people can sort of fire away. So the perfect lifestyle for me would be the diet that I've just said then. So mainly whole foods. These are the key things anyway that I would say. So a whole food diet. Then you've got activity. I think we should be active every single day. And that has changed a lot since I was younger. So when I was in late teens, early 20s, I would do, probably not even then, probably mid 20s, I would be more inclined to have maybe a rest day. And on that rest day, I would still walk, but it wasn't intense at all. But I think it's better to have a dialed back intensity each day with regards to exercise, and be able to do that every single day to a decent intensity, because like I said, energy balance is key. So I would say exercise daily, and you would have to you would have to incorporate within the weekly thing, you would have to do zone 2, which is fat burning. You would have to do weightlifting, and you would have to do mobility. So that is more your yoga. Again, something that can have its own video is exercise for health, but the last two definitely overlooked in terms of health is mobility and yoga, because a lot of people tend to get injured. Definitely, I was one of them, where you're lifting too much weight, thinking that's the best way to go, but you are only functional within one plane of movement. You are not doing it when you can rotate. So that is one thing. Exercise daily, whole food diet, something that I need to get better at, and I am becoming better at it. Sleep 7 to 8 hours daily, each day. Mindfulness. So this is your, what would you call it? Your mental health is mindfulness. Now, regardless of where you are with life situations, you should always have the ability to be present and also put things into perspective. And that is different for different people. So for me, I deal with them very, how would you put it, very personally, very closed up. I've started to write a few things down, but that's how I do it. And maybe mindfulness for me is getting a long bath, for example, or could be just simple things, even having a cup of coffee of a morning. That's a bit of mindfulness for me, and it's all individual. So that is something that you need to work out for yourself. Another thing about a perfect life, something we overlook, is purpose. And the Japanese have a term, and I think it's called, oh, I'm going to botch this up. It's called ikigai. I actually can't even spell it. But it's a sense of purpose, because if you don't, then you psychologically are not happy, fulfilled, and then you can lead into all these physical symptoms here and lower your quality of life. So having a purpose is a big thing for me. And what else do I think you need to incorporate to have a healthy lifestyle? Recovery. So besides sleep, you need to recover. Something I underuse. I do not use it enough. But when it comes to recovery, a lot of people go for sauna, you go for ice baths, and you go for massages. Now, I had a massage for the first time in 2.5 years. I think it was last week or the week before. My back was described as not in the best, not in a fit shape in the sense of knots, muscular, yes, not in terms of knots, and that's because I don't do that. You hold a lot of tension in things because of past experiences, whatever it may be. Ice is very good. It doesn't have to be to the levels that a lot of people do on social media. And sauna, if you are a man, you should be protecting your private parts, because you can reduce the quality of certain fluids, which is outside the scope of this video. But that is what I would say is an ideal lifestyle, and there are things that we can all improve on. And again, it's all about balance. There's no point in designing the perfect lifestyle if you have no intention or no ability to fit to it. I fit to a lot of them things, and I would rather someone slowly creep into a lifestyle where they can sustain it, as opposed to go full blaze for 12 weeks like they do in all of these, I don't know, summer shred or whatever it is, whatever program it is. I'm not trying to knock them, because they are actually good in their own right, but I mean from someone who has no background in health and they just want to get healthier, it is better for someone to go and do baby steps into it, as opposed to deep dive into it and never sustain it. So that's the perfect lifestyle. What is your next live versus video outlay? So with regards to YouTube, I'll end on this. I have been wondering what style to go down. I decided to buy some scrubs because it gives me a better aesthetic and sort of blurs the line, or removes the line that was quite blurred in terms of, was I a sports person, was I a personal trainer, or was I a clinician? So I feel like I'm going to go down the clinician route, because that is what I want to do as a job in terms of medical education. But I want to package up the talks that I do for all the clinicians and provide it to other people here, so that people can benefit from it. And well, obviously the NHS, if you are from the UK, is having a lot of hard issues with access at the moment. So if you've got things like this where you can at least action it yourself, again, it's not medical advice, but by being able to action things, I think it's safer for people to have this information than to wait 10 to 12 weeks, get substandard education or advice, and then leading into poor health outcomes going forward. But yeah, in terms of this, I wanted to do more of these lives. It's easier for me. It's easier to just pick the camera up and film. There's no script required. Just put the thing on, and then I can have an interaction here. So that's probably what I'm going to be doing going forward. I was wondering about this, yeah. So, yeah, the scrubs, that was the reason, because if you ever watch Dr. Mike on YouTube, he's got obviously a massive following in America, but you can actually tell he's a doctor. If he wore a trackie, for example, you'd think, oh, what is this guy? And I think that was the issue with me, is because I have a lot of fitness stuff on my social media that people thought I was just a personal trainer who maybe had a bit of an interest in this, where actually this is my full-time job, and I've got diplomas in medication and prescribing, so that is why I've gone down the scrubs route, and it sort of fits in more. The lives are going to be happening more frequently, like I said, just easier to interact, easier for me to get up and film. But there are a few things where I would actually do a video where it's probably going to have a bit more benefit going forward. So there is one video I want to do, and that's what I'm going to end on, is I want to do a video on bowel cancer screening. And the reason being, it's Bowel Cancer Awareness Month. I had a few family members who've lost their lives to it quite early on due to the fact of a lack of education and lack of awareness of why testing is essential. Obviously, I was not into the healthcare field at that moment in time, but yes, I'm going to do a video on that and show people how to do a fit test. I've done one personally as a patient, but it's always good to give people the advice. So that's what I will be doing the long form videos for, but lives for more things like this where I've just done a presentation and think it's better if people benefit from it. But thank you very much for joining in. If you've got any future suggestions, by all means, I think I'm going to put a post on the community tab. By all means, add a suggestion to that. And I'm going to try and do these maybe twice a week, definitely once a week. And if you're wondering where I'm looking at another screen so I can actually see the questions. Otherwise, I would have a hard time looking at them. But thank you very much for watching and listening. Add any suggestions, and I will see you in the next live, hopefully at some point this week.